Hello, you are listening to the RxConnect Podcast. This podcast is brought to you by the Pharmacy Operations at the American Oncology Network. I am your host, Melody Chang, Vice President of Pharmacy Operations at the American Oncology Network. Happy New Year and welcome to our first episode of 2025. With the Inflation Reduction Act signed back in 2022, many of its key provisions are now beginning to take shape. Today, we will take a closer look at what these changes could mean for pharmacy operations, oncology practices, and the patients we serve. Let's start with a quick recap of what the Inflation Reduction Act, or IRA, is and why it's so important. The IRA was designed to address rising inflation across various sectors, including healthcare. Its goals for the pharmaceutical industry are clear: to lower drug prices, reduce out of pocket costs for Medicare beneficiaries, and ensure access to life saving therapies. Here are some of the key components of the IRA. 1. Medicare drug price negotiation. For the first time, Medicare can negotiate prices for certain high cost drugs. This started rolling out in 2024, and the first negotiated prices will take effect in 2026. Second, out of pocket caps. Starting in 2025, Medicare beneficiaries' out of pocket costs for prescription drugs will be capped at $2,000 annually. 3. Inflation rebates. Drug manufacturers must pay rebates to Medicare if prices for their drugs increase faster than the rate of inflation. 4. Medicare Part D redesign. The IRA is reshaping how Medicare Part D works, reducing financial risks for beneficiaries while shifting more cost sharing to drug manufacturers and health plans. These provisions are already changing the landscape of healthcare and pharmacy operations. So let's discuss what this means for us. The IRA has significant implications for pharmacy operations, especially in community oncology. Here's what we are seeing so far and what to expect. 1. Drug price negotiation. Medicare's price negotiations for high cost drugs could affect reimbursement rates. This will require oncology practices to carefully monitor their finances and adjust accordingly. 2. Part D redesign. The redesign of a Medicare Part D adds complexity to patient billing and reimbursement processes. While this change reduces costs for patients, pharmacies will need to adapt their workflows to handle new cost sharing responsibilities. 3. Operational adjustment. Pharmacies may face challenges like delays in drug access or inventory changes due to price negotiations and inflation rebates. It's crucial to collaborate closely with the manufacturers, payers, and providers to ensure continuity of care. These changes mean that pharmacy teams must remain agile, informed, and ready to adapt as the IRA continues to evolve. Now, let's talk about what the IRA means for patients. The good news is that many of these changes are designed to reduce financial burdens and improve access to care. 1. Out of pocket caps. Starting in 2025, Medicare beneficiaries will pay no more than $2,000 annually for prescription drugs. This is a huge relief for patients with high-cost medications, especially in oncology. Second, improved access to therapies. By lowering drug costs, the IRA ensures more patients can afford the treatments they need without sacrificing other essentials. 3. Financial predictability. The new cap provides patients with greater clarity on their healthcare expenses, making it easier to plan and budget for their treatments. 4. Potential challenges. On the flip side, there may be increased formulary restrictions or delays in drug availabilities as the payers and the manufacturers adjust to the IRA's provisions. As healthcare providers, it's our job to help patients navigate these challenges, advocate for their needs, and ensure they have access to the therapies they depend on. So, how can we prepare for the changes ahead? Here are a few key strategies. 1. Stay informed. Keep up to date with the IRA's evolving provisions and educate your team on what these changes mean for pharmacy operations. 2. Educate patients. Make sure patients understand their benefits under the IRA and how it impacts their out-of-pocket cost. 3. Advocate and collaborate. Working closely with payers, manufacturers, and policymakers to address challenges and advocate for solutions that benefit patients. 4. Leverage technology. Use technology to track changes in pricing, reimbursement, and cost sharing. This will help streamline operations and improve patient care. By staying proactive and patient-focused, we can turn these challenges into opportunities to better serve our communities. As we step into 2025, the impact of IRA on pharmacy and oncology will continue to evolve. By staying informed and adapting to these changes, we can help ensure that patients benefit from this process. Thank you for tuning in to this episode of RX Connect. This podcast is brought to you by the pharmacy operations at the American Oncology Network. We hope you enjoyed this episode and look forward to seeing you at the next one. Thank you.